Hello everyone and welcome back to my channel. I hope everyone's having a good day so far. Speaking of days, today's February 7th, and February 7th is the start to Feeding Tube Awareness Week, which is a week dedicated to spreading awareness and teaching, advocating, learning, spreading the word about what a feeding tube is and how everyday life looks for someone with a feeding tube. For this week's video, I decided to make a video talking about what a feeding tube is and the different types. So with that said, let's get started. Okay, so what is a feeding tube? A feeding tube is a small plastic tube used to give nutrients to an individual who is unable to take in enough nutrients by mouth orally. There are many different reasons why an individual might need a feeding tube. This can include things like esophageal disorders, gastrointestinal issues, malabsorption, the inability to maintain body weight, so low BMI, things like that. But with that being said, there are also other reasons for a feeding tube. I know some people who use their feeding tube to vent, drain, and to administer medications. Personally, I have a feeding tube due to a condition known as gastroparesis. It's a motility disorder affecting the muscles of my stomach. It limited my ability to take in enough nutrients orally, so my team of doctors and I decided that it was time for me to get a feeding tube. With that being said, not everyone with gastroparesis will need a feeding tube. Each individual is different and each individual will react differently to different treatments and medications, so it's always important to bring up any concerns, worries, anything like that with a knowledgeable healthcare provider, with your doctor. I can only speak from personal experience. Now that we know what a feeding tube is, let's dive into more specifics. So there are two different types of feeding tubes. You have nasal tubes and you have surgical tubes. Both can be used for long-term and short-term use. Typically, doctors will use nasal tubes for more short-term care and surgical tubes for longer-term care. It all depends on the patient's needs and what the treatment plan is. For nasal tubes, there are two types, an NJ and an NG. An NJ, also known as a nasal jejunal tube, goes from your nose, down your throat, past your stomach, and into a part of the small intestine known as the jejunum. An NG tube, or a nasogastric tube, is the same concept. It goes in your nose, down your throat, and into your stomach. For surgical tubes, there are three different types. You have a G tube, which goes directly into the stomach, a J tube, or a jejunal tube, goes directly into your jejunum or your small intestine. And then the third option is a GJ tube, which is a combination of both types, gastric and jejunal. All forms function relatively similarly, the only difference being how they are placed. There's also another form of nutrition known as TPN, or total parenteral nutrition. This is a feeding method that bypasses the entire gastrointestinal tract. It is administered through a vein or through a central line, and is typically more so known as a last resort effort to get nutrition. Okay, now for one of the bigger portions, how is a feeding tube placed? On Instagram, I usually get a lot of messages and DMs being like, Haley, what is it like getting a feeding tube placed? Does it hurt? Is it painful? So let's talk about it. We'll start with nasal tubes first. When I was inpatient at the hospital getting my first feeding tube, a child life specialist came by and she brought me a stuffed animal to help explain what the process was going to be like. And it really helped me just to visualize exactly what was going to happen. So I'll tell you what she told me. Like we discussed before, an NJ tube and an NG tube goes in through your nose, down your throat, and into your stomach, or with an NJ tube into your small intestine. That's how an NG tube is typically placed. Depending on your hospital, they can have different protocols and whatnot, but in my experience, this is how tube placement went. So it was usually done in interventional radiology with an x-ray to check placement. So beforehand, before checking in and whatnot, what happens is they will spray your nose and the back of your throat with numbing spray to make you feel a bit more comfortable. And they will start inserting the tube into your nose. Sometimes they will let you drink water in the process to help you get the tube down easier. When it hits the back of your throat, they will tell you to start drinking water, start sipping, things like that, to help the tube go down a bit smoother. And then once it's placed in the right position, they will check with an x-ray if it's an NJ tube. And typically with an NG tube, if I'm thinking right, they just check based off pH levels and things like that. Sometimes they will check with x-ray depending on your hospital. With NJ tubes, depending on your anatomy, they have a tendency to flip into your stomach. So it's important that you get that x-ray to make sure it's in the right place. Because especially in my situation, if I were to get an NJ tube placed and it flipped into my stomach, because of my gastroparesis, it would cause a lot more problems having my formula and feedings go into my stomach rather than my small intestine. Let's now talk about surgical tubes. Surgical tubes tend to be used more so for long-term use. They're also referred to as permanent tubes, but don't be scared by it being called a permanent tube. Everyone is different. Some people might need their tube long-term, whereas another person may be able to get theirs taken out and get by without one. It all just depends on your body and how it reacts and your team's plan about what's going to happen moving forward. I have a GJ tube, also known as a gastrojejunal tube, which is a gastric tube that has a extension to it that goes to your small intestines, leading to your jejunum. Oftentimes, and in my case specifically, I use the G portion for venting and draining and the J portion for tube feeds. With my knowledge, surgical G tubes and surgical J tubes can be changed at home. However, with surgical J tubes, because of the extension that goes into the small intestines, it has to be replaced in interventional radiology at your hospital. When you get your first GJ tube placed, chances are, depending on how old you are, I know with younger kids, they do place low profile buttons first, but if you are older, they will probably place something called a dangler tube, and that's what I have. This is what a dangler tube looks like. It's a long tube that comes out of your stomach. This is typically placed first until your stoma can heal. And your stoma is basically the opening to your stomach. Usually this takes between 4 to 6 weeks before they switch you over to a low profile tube. After your stoma has healed up and you're able to switch to a low profile tube, if that's what you and your team decide on, moving forward for tube replacements, they can be left in place from about 4 to 6 months before needing a tube change. This all depends on your doctor, your hospital, if the tube gets clogged, if it breaks, just a lot of factors play into it. Your team will know when the right time is for you. With that being said, one of the downsides to a GJ tube is the potential for them flipping. Like I said previously with the NJ tubes, the same thing can happen with GJ tube. This basically means that, like with the nasal tube, how it flips up into your stomach, the same thing can happen with a surgical GJ tube. The extension does the same thing, it flips up into the stomach. If that happens, you would then have to go to the hospital to get it changed, because a lot of people who have GJ tubes tend to use the G portion for venting and draining and the J portion for feedings. And so having it flipped up into your stomach can cause problems, and it's not the proper use for it for some individuals. If the tube consistently flips, there's always the option of having it switched from a GJ tube to a separate G and a separate J tube. And that is the basics to feeding tube. Make sure to come back and check out my future videos this week, as I will be posting more about this topic. I hope you have a wonderful day. Bye.